Okay, this is the meniscus repair technique. So first, we have to identify which meniscus is involved. And then in this case, it's lateral meniscus. So after we have done our release, we have to reduce the tear. So we reduce to the footprint, and then evaluate the congruency of the reductions in relation to the articular surface. So in this case, there's a bucket handle tear of your lateral meniscus. We reduce it and we evaluate the reductions of the meniscus, and then we trim the edges of the meniscus and the surroundings of tissue. So the next stage, we identify the location of repair to stabilize the meniscus. So the next step is to repair the meniscus by using sequence technique. So there's a few steps of the sequence using the sequence. So first is pierce, and then rotate. Third is deploy the implant, and lastly we do a tension. So now we find the suitable first implant insertion, and then we rotate and we wiggle a bit the implant, and then we find for the second spot or second side to put another implant. So this is the lateral meniscus. We have to bear with, be careful with our tendon, popliteus tendon. And then after deployment of the implant, we wiggle and take out the needle, and we lock the suture, and then we apply the tension on the tissue. Automatically the torn meniscus will reduce back to the place and stabilize to the surrounding capsule. So the next stage is we plan for the third implant. This one we are using the 4 sequence implant. So once again we try to avoid the popliteus tendon, avoid piercing the popliteus tendon, and we deploying the third implant and follow the PRDT step: pierce, rotate, deploy, and tension, and repair back the meniscus. So that's the sequence, and we apply some tension and they will reduce, and lastly we deploy the last implant. So we deploy the last implant now, and then follow the steps. So we have completed our repair. So now we are using the RF probe to clear the soft tissue surrounding and do a thermal shrinkage of the degenerative part of the meniscus and smoothen the edges of the meniscus. Now the meniscus back to the normal place, and we can see the congruity of the lateral compartment. And yeah, we have done a very good job on the meniscus repair. Thank you.